The following segment is sponsored by Inovia Vein Specialty Centers.
Welcome back to AM Northwest. You know, blood clots that form in your veins are a medical emergency, but they often go undiagnosed. Our own Tammy Hernandez learns more about deep vein thrombosis and why there's a day dedicated to bring more awareness to it.
I'm in Happy Valley at Inovia Vein Specialty Centers with Dr. Todd Jones, and it's World Thrombosis Day. And for people who don't know what thrombosis is, why is there a day to have awareness about it?
Well, World Thrombosis Day is October 13th, which is today, and it's designed in a way to help increase awareness about DVTs, which it stands for deep vein thrombosis, which is a type of clot that can occur anywhere, but in particular in the legs, which can be very dangerous and is often underdiagnosed.
And why is it underdiagnosed? Is it not obvious when we have it? What should we be looking for?
So the signs and symptoms of it and what to look for can vary from patient to patient, but in general, acute onset, meaning sudden onset or recent onset swelling of the lower extremity, either one leg or both, or pain in the calf or behind the knee, or a change in coloration of the leg, either white or blue or even red, can signal that you might have a clot. Okay,
and if you have one of those symptoms, what should you do?
If you have one of those symptoms, you should immediately contact your medical professional. If you have a primary care physician, you'd want to let them know. But if it's after hours or you're not able to get a hold of them, then you want to proceed to an ER or an urgent care.
Okay, so it's serious enough to go to ER if your doctor is not available?
Absolutely. An undiagnosed DVT can be life-threatening.
Okay, so I see why there's a World Thrombosis Day. We need to bring attention to it.
Absolutely.
So you treat that here. What is the treatment like for a deep vein thrombosis?
Well, it starts with diagnosis, and we generally use what's called ultrasound to diagnose them. It's very sensitive, and it's an easy study to do, and it's non-invasive. And then if we diagnose a deep vein thrombosis, the treatment can vary, but it does include things like blood thinners or even observation, but it depends on where it is, how large it is, and the specific anatomy, and sometimes patient risk factors as well.
Okay, and you treat a lot of things here because I feel like vein problems are pretty common. So tell me about some of the more common things that you treat here.
Yes, vein problems are very common, and deep vein thrombosis is only one aspect of that, and that's more of a dangerous aspect.
Right.
Most vein issues are sometimes cosmetic, sometimes they're quality of life issues. Varicose veins are a venous disease. Spider veins are also in that spectrum, but they're more on the cosmetic side sometimes. We treat all of that here. We treat leg swelling. Most of the treatments are done same day in the office. You walk in, you walk out.
Oh, that's
They're
nice.
very well tolerated. We don't require general anesthesia. They're very safe. And you don't have to live with achy, crampy, itchy, burning veins.
Right. We have a before and after of a varicose vein, and there's even discoloration, which I don't think I've ever associated with varicose veins. Can you tell me what's happening with that?
So with that particular patient had what's called stasis dermatitis on the inside of their ankle, which is that redness that you see in the photo. And on top of that, they also had some very large varicose veins, and they had some swelling. And that is a little bit more advanced stage of venous disease when you have swelling or skin damage or skin inflammation. But in that case, we were able to treat that patient's veins, and that actually spontaneously resolved, which frequently happens. There are cases, however, where damage is ongoing, or the disease or the varicose veins get ignored for years or even decades because people don't realize that there's a treatment for them, or don't realize that it's something that should be treated. And then you can get much more severe damage of the tissues.
Is a varicose veins treatment, is that something an insurance would cover?
Generally, most insurers and Medicare cover the treatment of varicose veins.
Okay. And now let's talk about the cosmetic, the spider veins. You also treat that. We have a before and after, which is incredible. Is this, tell me what a treatment like this what it would be like.
The treatment for spider veins that we do here in the office is primarily, first, if we look at a patient's leg and we suspect that there's more going on than just the spider veins, which there are signs that might point us to that, but that's not everybody, we might want to address that first. But for purely cosmetic spider veins, we do what's called injection sclerotherapy for that. That's one of the best known and treatments that's been around for many decades to treat spider veins. And it's done with a very small, very fine needle, and generally a very well tolerated procedure, and again can be done the same day and has great results.
Okay, that's nice. Same day results. You gotta love that. Okay, so it's World Thrombosis Day, a great day to be aware of your own vein issues, and if you have any issues, consult your doctor. If you need or want more information about Inovia Vein Specialty Centers, they have 6 locations in Northwest Portland, Tanasbourne, here in Happy Valley, Tigard, Vancouver, and Bend, and we're going to have a link to their website. You'll find that on our website at KATU.com. Thanks so much, Dr. Jones.
Thank you.
Back to you.
And thank you, Tammy.